In this laser clinical procedure, we're going to be demonstrating periodontal treatment or periodontal curettage using the LTM precise laser. Now, lasers have been used quite a bit for curettage, and we're going to demonstrate this to get you started. But when you take the actual full certification course that's included with the purchase of your laser, we'll go more in depth into how to follow up the treatment protocol, how to incorporate it with scaling and root planing, the insurance coding, the billing, all the aspects that you can incorporate this into your practice or into your hygiene department to get the kind of results that are real common. Now, what are common results? Reduction in pocket depth, reduction on bleeding and probing, clinically better tissue appearance, and hopefully some pocket reduction and actual clinical attachment. In this case, we're going to start out, we have some up to an 8mm pockets between 7 and 8. We also have some gingival inflammation and bleeding and probing. So we'll get through and start on this procedure, but just remember, this is just a starting point, and as you continue on with your laser learning and take the certification course that's provided, you'll see a lot more video and procedural tips to help you out. So as we start out, in this case we're going to be using a pulse setting. Now you can see at first we're just sort of probing around with the tip to get a feel for it going into the pocket, and you can see the amount of bleeding just from probing around with that tip. We haven't even turned the laser on. Now when we're using the laser for periodontal treatment, I usually like to use a pulse setting. I like a power output of about 1 watt. And you can see the aiming beam there, it's flashing because we're using the laser in a pulse setting. So I would set my laser at 2 watts, pulsed 50% on, 50% off, a 50% duty cycle, and we're moving it back and forth in and out of the pocket. You can see the tissue that's being removed. That's the diseased epithelium that's sticking to the tip of the laser as we work the pocket. You're going to be going in for just a few seconds and taking that out and constantly wiping or removing that buildup on the end of the tip. If that buildup is left on the end of the tip, it's not only going to make it more difficult to place the tip into the sulcus, but it's also going to continue to heat up that material on the end of the tip and will cause a little more plume when you're working. So you want to remember to take that and remove that diseased tissue. We're just using a wet 2x2 and wiping it straight back. Now as we place the tip in, we're going basically to the base of the pocket, just gently to the base of the pocket, and we're interacting with that soft tissue. We're trying to focus and direct the laser more towards the soft tissue than the root of the tooth. In this case, you can see we still have quite a bit of bleeding. And one of the questions that comes up is how long do we go into a pocket and when do we know we're done? Part of it is depth of pocket and access. The deeper the pocket, the more diseased tissue there's going to be. Now also, if the pocket is highly inflamed, like in this case, we're going to get more tissue out. In the case of maybe someone who smokes, it might be a little more fibrotic. You might not get as much bleeding as you do here. So you can see it's sort of a short stroking motion. We're going back and forth at all levels of the soft tissue, from the base of the pocket and working it back up towards the height of the gingiva or towards the top of the sulcus. The idea is to remove this diseased epithelium, reduce bacterial counts or kill the bacteria in the pocket, and this is combined with scaling and root planing to clean the root surface, because the laser is not going to remove the calculus from the root surface. And when this is combined with scaling and root planing and we clean the root surface, we remove that diseased epithelium, the concept is that we can get some kind of reattachment or regrowth of healthier tissue to the root surface, resulting in pocket depth and resulting in a lot less bleeding or elimination of bleeding on probing. Once we continue on here and we get that tissue, or we think we've removed all that diseased tissue, which is usually variable about how long you place the tip into the pocket, what you're getting out of it, and usually the bleeding will stop when you're done, because what's bleeding is that more diseased or granulation tissue in the pocket. You're thinning that pocket out from the inside, and you see that the bulbousness of that papilla will actually decrease as you use the laser more and more. So we're getting to the point where we're removing that tissue. You might also do a little recontouring of that tissue. As you can see here, we're actually coming out of the pocket and just recontouring that tissue to remove a little excess tissue or a little excess of that papilla, because it's the shape is too bulbous and it just makes it difficult to clean. So we're going in there, removing that, cleaning that up. As you can see, the papilla is looking a little thinner. And that's really, we'll give it a good wipe. You could also use some chlorhexidine to irrigate if you wanted to help flush that out before you're done. Now, when we're done, you can see we have a reduction in the pocket, or the tissue height. It's thinned out from the inside out. Post-op for this is, the usual post-op for this is to have the patient brush gently that night, chlorhexidine rinse twice a day, and then I like to see them back about a week later just for an oral hygiene check and to get their take on how they feel the tissue's progressing. But remember to have them brush and floss gently starting the night of the procedure.